Meanwhile, we are continuing to track how efficiently the rollout is going in both Kansas and Missouri. I-Team reporter Kat Reed following the doses being distributed and how many have been administered. She joins us to go in depth on what leaders are doing to speed up the process.
Last week, we told you that in Missouri, about 66% of the distributed doses had actually been given. Well, this week, as of Wednesday, that number is up to 73%. One thing the state says they've been doing is talking to providers and telling them to give the first dose within 7 days of receiving it.
We become concerned when there's a vaccinator or a region that is not administering or reporting those vaccines in a timely fashion, and we are very aggressive in making sure that those shots get into arms as quickly as possible.
It's also important to point out the data on this dashboard changes by the day and even the hour. The gap between doses delivered and the ones administered widens anytime a new shipment arrives.
And then that number will close as the week goes on, as those doses are administered. And then the next week when the new shipments arrive, the gap opens back up. So that is really a moving target.
Over in Kansas, as of Wednesday afternoon, the number of distributed doses that have been administered was at 60%. I do want to note that it started the day at 62%, but dipped as more doses were delivered. 60% is right where it was last week, but Governor Kelly's COVID advisor says the data doesn't really reflect what's going on in the state right now.
It is not reflective. There are a number of doses that we know have actually been administered to people, but aren't counted in that administered dose rate.
Dr. Marcy Nielsen explained the state continues to work with providers struggling to get their data into the system, while also encouraging them not to hold on to any vaccine. This was the message she wanted to share with frustrated Kansans waiting for their dose.
I'm very sympathetic, and I just want them to know we really are working as fast as we possibly can. We are constantly looking at ways to improve our system, and we will do whatever it takes to ensure that as many Kansans as quickly as possible are able to get access to the vaccine.
Like Missouri, Kansas is also asking for doses back from CVS and Walgreens. They overestimated just how much was needed for a federal program serving nursing homes. The state expects to get about 28,000 doses to then redistribute. I'm I-Team reporter Kat Reed, 41 Action News.
You know, folks, we know you have questions about the COVID-19 vaccine, including how to get signed up for notifications of availability in your region and how counties decide who gets the vaccine first. Head to KSHP.com and click on Coronavirus in KC for more information.